Hello, dear aquarist. Welcome to my case 214 about a fancy goldfish that was having a big red wound. So let me share my findings that I made in my PowerPoint. And it was a large wound, and we found internally tubercles with a bacterial infection. The fancy goldfish, well, I discussed problems on diseases of goldfish and many other ornamental fish in my books on fish diseases available in different languages. See the details below in the link where you can purchase them. And here we have, well, one of those fancy goldfish. You can see the big red wound that this fish was showing, and the fish was wasting away. Some other fish had big wounds like this one. Look at the big red wound. And the fish were dying after a couple of days. So there was a serious problem. Nothing else we could notice, well, except that the fish wasted away and died. And we examined the skin. Well, nothing particularly was observing than just necrotic tissue because the wound developed from inside. And also the gills. We found that the gills were very pale. Here I show you the gills. And in our observation, we saw the gills were in bad condition, some red inflammation, some pale parts. So the fish had internal problems with, well, the blood supply or the health of the organs. And when we checked the fish and we opened the fish and we see the bloody coloration of all the organs, the bloody here, and here was the wound. You can see here the wound, which was caused from inside out from the organs, and particularly here we could see the very large kidney, which had, well, whitish tubercles. Look at it, the whitish nodules inside the kidney tissue. And then we examine that in a microscope and we see these tubercles here that destroys the kidney. And of course then the fish will get weak, get wounds, get other bacterial infections. The gills will become pale, the gills will suffer badly because the kidneys are not functioning, etc. So the fancy goldfish, well, the very bad ones, like with the wounds, you better put them gently asleep because it looks like a Mycobacterium or a fish tuberculosis. The wounds can be caused by other secondary bacterial infections. So that's something you have to consider, that usually it's different kinds of bacteria that develop together or afterwards when there is already a Mycobacterium infection. You can treat with an antibacterial medication. Like I said in my previous videos, you can use like antibiotics. Some people tried minocycline, erythromycin, oxytetracycline, but better ask your fish doctor for good advice, particularly when it concerns antibiotics. And you can help the fish to give those that still are eating, are doing fine, and not developing wounds yet. Give them a good functional fish food that helped them during a bacterial infection. And as the Dr. Bassleer Fish Food Fuco or grapefruit seed extract moringa. Well, more information on diseases available in my books or in my trainings that I can give you on my Patreon channel. So I hope this video explained you a problem, why a big wound can be caused on a goldfish. Stay tuned, subscribe, so you learn more about fish diseases and diagnosis and treatment.